Hello there, my name is Glen Davies and I'm a first contact physiotherapist and specialist orthopaedic practitioner for Key Healthcare in Warrington. I'm also a senior lecturer in physiotherapy at Manchester Metropolitan University. My colleague Dr. Peter Goodwin is also a senior lecturer and programme leader within physiotherapy at Manchester Metropolitan University as well. We would like to share with you the findings of our study in which we explored whether health motivation is associated with recovery from low back pain. This was a prospective observational cohort study of people suffering with non-specific low back pain referred to physiotherapy in a community outpatient service. We chose to observe people with chronic non-specific low back pain because this is the leading musculoskeletal complaint worldwide and the sixth leading cause of disease burden globally. Historically, treatments have been directed by clinical judgment, but this fails to match the right people to the right treatment. This drove the need for subgrouping or classifying people with low back pain, and risk stratification became the leading model, with the start back the primary tool of choice. Healthy Foundations was a lifestyle segmentation project and one of the key outcomes from the Department of Health's Ambitions for Health. It used a strategic framework for maximising the potential of social marketing and health-related behaviour in 2008. A model of health behaviour was developed exploring the factors that drive poor health behaviour. Using health segmentation, it was possible to determine what motivates people to change their unhealthy behaviours. Segmentation can be a powerful tool to help understand population subgroups and focus resources where they are needed the most. Moving beyond demographics and factoring in attitudinal and psychographic data, a person's overall approach to life, including personality traits, values, and beliefs, provides a much rounder picture of individuals and forms a good starting point for developing tailored, individualised interventions. The full segmentation model captures the complex dynamics between an individual's personal motivation to live healthily, and this is the motivation segment on this model, and how these vary within the context of their social and material circumstances. And this would be represented by the environmental dimension of the segmentation. It allocates people into one of 5 health segments, including health-conscious realists, balanced compensators, hedonistic immortals, live for today, and unconfident fatalists. And the model on this slide gives you an overall picture of how these segments sit together within the overall health model. Our overall aim was to test previous modelling and proof of concept that health segmentation can be used to inform treatment approaches. Our specific objectives were in identifying the specific motivational segments apportioned to people with non-specific low back pain. We also wanted to map the 5 health segments against the 3 risk groups of the StartBack tool. We wanted to observe whether a person's level of deprivation influenced the care they received, and we also wanted to determine whether the mode of treatment delivery reflected the individual health segments. Data collection was completed at 3 community-based NHS physiotherapy facilities in Wigan and Leigh over a 5-month period during the COVID-19 pandemic. We recruited consecutive patients with non-specific low back pain who satisfied the inclusion and exclusion criteria with or without unilateral leg pain. These were either self-referred patients or referred by their GP. We asked all participants to complete the SBT, which is a 9-item questionnaire, and the HSQ, which is a 19-item questionnaire. Both of these were completed electronically online. For the statistical data analysis, we used a Pearson's chi-squared test for goodness of fit, and this covered objectives 1, 2 and 4, in which we identified and mapped the individual health segments of the HSQ against the risk groups of the Startback tool. This also helped us determine whether the mode of treatment delivery reflected the individual health segments. We then used the two-tailed Spearman's row correlation coefficient to observe whether the socioeconomic factors influenced the treatment that was received. The primary limitation in this study was the relatively low number of participants that we were able to recruit. Unfortunately, this was significantly affected by the COVID-19 pandemic due to emergency service redesign and staff redeployment. Despite this, we were able to achieve a relatively low dropout rate and a fairly even spread of motivational segments within our population. A significant relationship was observed between the 5 health segments and the 3 Startback categories. This radar chart shows how those motivation segments were identified and mapped against the individual risk groups. Multiple motivation segments do overlap with the Startback risk groups, but referring back to Figure 1 on slide 3, this may reflect the wide variety of traits for each individual motivational segment and the variation in environments in which they live. This indicates that a broader range of factors should really be considered in the future when subgrouping people with low back pain. A significant correlation was also observed between the 5 health segments and indices of multiple deprivation. This box and whisker plot reflects the segmentation model by identifying health-conscious realists occupying the least deprived areas, whilst unconfident fatalists occupy the most deprived areas. The balanced compensator and hedonistic immortal groups appear to deviate from this pattern, but this may be explained by the low numbers of participants recruited. These were most likely recruited from the negative environments, which can be identified on Figure 1 on slide 3. Finally, a significant relationship was observed between the 5 health segments and the mode of treatment delivery. Health-conscious realists who have a higher self-efficacy level receive more virtual consultations. This motivational segment feels more in control of their own lives and takes a long-term view of health, which is very important to them. They are proactive and health conscious. Unconfident fatalists, on the other hand, have a greater external locus of control and require more face-to-face consultations. These participants were more demotivated with low self-esteem. They feel that their health is out of their control and do not feel good about themselves. And this group may represent the largest consumer of health services. These traits reflect the amount of support that they will require and could help to direct treatment provision in the future. The numbers recruited in this study were significantly limited by the COVID-19 pandemic due to emergency service redesign and staff redeployment. However, we were still able to identify and map the health segmentation of people with non-specific low back pain, and were able to subgroup according to best practice disease-specific risk stratification using the Startback tool. From our small sample in this proof of concept study, our findings of health segment and indices of multiple deprivation generally reflect that of the model, indicating that social determinants of health and people's motivation do influence the treatment that they receive, with the least privileged and those who are externally driven receiving substandard care. We also established that mode of treatment delivery, including virtual or face-to-face consultations, can be determined based on the health segmentation. This study therefore provides some proof that the concept of health segmentation may be beneficial in treating non-specific chronic low back pain. I'd like to take this opportunity to thank Dr. Goodwin for helping to conceptualise this project and for supervising me through this process. I'd also like to acknowledge and thank Katie Lockie and Kate Toon for facilitating this project in the clinical setting, along with Tracy Rowe for helping with data collection and synthesis. Please feel free to visit the MMU website using the QR code available on this page, where you can find out more information about the HSQ. Thank you.